Morphine. Morphine is a very potent member of the opiate family of drugs used in the field of medicine to relieve pain. Opiates are natural products of poppy seeds, and synthetic versions can be manufactured. They work on the area of the brain that perceives pain, reducing the sensation. Because morphine is such a strong drug, it is meant to be used only by people in severe pain. This is because the side effects are significant and the risk of addiction is high. Morphine can be taken as needed for certain types of acute, severe pain, such as that caused by a bad injury. And it can also be administered continuously for relief of chronic pain, such as that experienced by cancer patients. Friedrich Wilhelm Adam Suturner was a German pharmacist who first produced morphine in 1805. Suturner isolated morphine from opium, which is the dried latex sap present in poppy flower seed pods. It was the first isolated active ingredient of a plant. He called it morphium after Morpheus, the Greek god of dreams. Although it is not a hallucinogen, as the name might imply, it is more than just a pain reliever. Morphine also produces a euphoric mental state and relieves anxiety. This euphoric feeling made it a popular recreational drug. Historically, morphine was available over the counter, but widespread abuse led to its classification as a controlled, legally regulated substance. Heroin is a more potent and faster-acting derivative of morphine, and it soon took over on the street as the opiate of choice. But even today, when heroin addicts have trouble finding their drug, they often use morphine as a substitute. Interestingly, morphine was used early on to treat opium addiction and even alcoholism, until doctors realized that it was more addictive than both of those drugs. Because it is so addictive, doctors must exercise caution when prescribing morphine. When it is used to alleviate pain in people who are dying, addiction is not a concern, and the drug can be used to make the patient more comfortable during his or her final days. However, when it is used as an analgesic, pain reliever in patients who are in severe pain but not dying, precautions should be taken. Dosage should be closely monitored, along with the appearance of withdrawal symptoms. Withdrawal is an indicator of addiction. It manifests itself as physical signs of the body's need for the drug. In the case of morphine, these include nausea, diarrhea, fever and chills, watery eyes, a runny nose, headaches, body aches, tremors, and irritability. Tolerance is the other main sign of addiction. Tolerance refers to a patient's needing more and more of a drug to achieve the same effects. Not only is morphine physically addictive, it is also psychologically addictive. A morphine addict, having gotten through 8 to 12 days of withdrawal without resorting to morphine use, no longer has any physical dependence. The body becomes accustomed to not having the drug and resumes normal functioning. The cravings, however, will persist because the person has become psychologically dependent on the drug. They crave it and have a difficult time functioning without it. This can often lead to severe depression and anxiety. Many people have difficulty sleeping and even develop amnesia. Self-esteem is diminished as the person copes with living life without the help of a drug. Not surprisingly, relapse is very common among morphine addicts, especially when the factors in their lives that led them to drug abuse are not changed. A study of morphine addiction in rats illustrated this point. It showed that if the rat's environment was made richer and more interesting after the removal of morphine doses, it coped better with psychological withdrawal. Morphine is a highly effective drug that can be used to alleviate pain, but it should be used under the close supervision of a doctor. The risk of addiction is high, and withdrawal is a painful process, the psychological element of which can last a lifetime.